I love my job. Here's another case of somebody who just responded really well. This is an 80-year-old woman who comes into me about a year and a half ago. She was international and moved here near my office. And of course, after long travel with lots of baggage and so forth, she had some neck and lower back trouble. She also had some balance issues. And in other shows, I've talked about vertigo and dizziness and how we can maybe handle that in the chiropractic office. She had sharp neck pain at times. Her lower back was achy. Now, when she was overseas, she had chiropractic care once a month for 20 years. And it was always helpful. So she was very familiar with chiropractic care and the benefits that it gave her. So I worked on her for 3 weeks, and her lower back was much better. Neck and middle back were back to typical levels, some stiffness, and her balance was back to normal, which was great. So we put her on a plan for about a year and a half, once a month. And April of this year, April of 2021, she had sore throat and difficulty swallowing. She had some urinary tract infection symptoms. She went to urgent care. They diagnosed strep throat and bronchitis and gave her antibiotics. Well, she didn't have a good reaction to the antibiotics, so we helped repair her gut with some other tricks that we have in the office. We did no dairy products, we did probiotics, and for the UTI, we gave her some Uber, Ursi, and D-Mannose supplements. I've talked about those in the past, you might be familiar. And all of that cleared up really nicely. In June of this year, 3 weeks prior to her visit in June, now this is the ergonomics gem I wanted to share with you today. Now listen, she was lifting her mattress to tuck in her sheet. Now she's 80, she's not the largest individual on the planet, so to reach in a precarious position like this, to lift the mattress up and tuck it in like this, you can imagine what that can do for somebody in shape, right? She felt sharp middle back pain. It was severe enough she had to go to urgent care. They took x-rays. They diagnosed her with a compression fracture of her middle back from that strain, right? Fortunately, it resolved mostly in a week. The pain did, and the compression wasn't super significant. So we had a laugh about it. She laughed about it. And I said, well, what should I do? And I said, don't make your bed. I really said that. She's like, oh boy, I'm going to be such a sloth. It was really funny. But she took the message. She says, I can't afford to do that. And here's why, because she's actually moving back internationally here. So her middle back and lower back were off and on achy because she was starting to pack to move back home. Okay. So she's doing great. She's right now packing to leave, and she sent me an email today, which prompted this show. She said, thank you for all you've done for me. Your work, skill, and advice have certainly improved my posture and neck positioning, and I'm grateful for your kindness, interest, and encouragement. Every hour on the hour, I'm doing the stretches. I will certainly let you know when I finally arrive safely at my destination. It has been a pleasure to know you and work with you to retain my flexibility and good health. I am very grateful. Wishing you all the very best in the future. That's why I love my job. She just wrote me such a beautiful email. And I responded back to her. I said, you're very welcome. I'm happy to know I could help. And she's just a wonderful human being as well. So I made the comment, it has been a pleasure to know you. If there were more people like you on the planet, spaceship Earth, it would be a much nicer place. Please let me know when you arrive. And she wrote me back. I really appreciate your kind words. I believe it was a great experience for us to work together and to achieve definite improvement. I've been doing one of the back exercises. Again, she's been packing to move, so she's been lifting and bending and twisting and so forth. I've been doing one exercise frequently because I'm doing a lot of physical work getting ready to move. You will certainly hear from me when I get back to my destination. Thanks again for everything, especially your lovely email. Again, she's 80, great response, spinal stuff, even a compression fracture, turns it around, learns an important ergonomic thing, knows a bunch of exercises that strengthen her posture. Her posture is definitely better now than it was a year and a half ago. A lot of us can't say when we're like this when we're 80 that it's actually going to get better, and she did, and that's why I love to do what I do. I'm Dr. Scott Fuller. Thank you.